Recurrent cystitis is a disconcerting condition that plagues many, predominantly women, and stems directly from the urinary system. It manifests as inflammation of the bladder, instigated by bacterial infection. If left unaddressed effectively, it can recur multiple times, engendering physical discomfort and impacting overall quality of life. The crux of the matter is that urinary tract infections are frequently not eradicated completely, leading to the development of recurrent cystitis. If you've experienced recurring episodes of pain while urinating, a persistent urge to urinate, and even noticed blood in your urine, you may be dealing with a recurrent urinary tract infection. These symptoms are characteristic of cystitis, and when they begin to manifest with frequency, medical attention is imperative. Early identification of recurrent cystitis is the first step towards effective treatment and the prevention of complications. The factors contributing to the development of recurrent cystitis are varied. From the presence of the Escherichia coli bacteria, the primary culprit behind most urinary tract infections, to inadequate hygiene, unprotected sexual intercourse, and even hormonal fluctuations, several factors can facilitate bacterial entry into the bladder. What many people overlook is that recurrent cystitis is not solely a consequence of negligence, but rather a result of a confluence of factors that render the body more susceptible to these infections. There are also cases where cystitis can be caused by other types of infections or even by irritations in the bladder wall. Regardless of the cause, recurrent cystitis requires effective treatment to prevent it from becoming a chronic condition. The initial step in addressing cystitis is a consultation with a physician. A diagnosis can be established based on the symptoms reported, and it is crucial to initiate treatment promptly to preclude the development of more serious complications. For instance, the use of antibiotics may be required to eradicate the bacteria responsible for the infection. However, antibiotics alone may prove insufficient, and some lifestyle modifications will also be essential. For individuals experiencing recurring episodes of urinary tract infection, a diagnosis of recurrent cystitis can be established based on several indicators. The most prevalent symptoms include a burning sensation during urination, a persistent urge to urinate, pain in the lower abdomen, and even the presence of blood in the urine. These symptoms may recur at regular intervals, which defines the infection as recurrent. If you are experiencing these symptoms, do not disregard what your body is telling you. Seeking medical advice is crucial. A physician can conduct urinalysis to detect the presence of bacteria and determine the most appropriate treatment for the infection. Moreover, it is imperative to inform your doctor about all previous occurrences so they can have a comprehensive understanding of your medical history and devise a more tailored treatment plan. If you are over 30 years old and have experienced frequent urinary tract infections, UTIs, you may be more susceptible to recurrent cystitis. However, it is crucial to understand that other age groups are not immune to this condition. Given the rising incidence of recurrent UTIs, particularly among women, it is imperative to grasp the most effective preventive measures and appropriate treatments to eradicate the issue definitively. If you have been diagnosed with recurrent cystitis, you've likely already tried antibiotics. However, what you may not know is that, to prevent the infection from recurring, there are several alternative strategies that can be implemented. Treatment should always be personalized, taking into account factors such as your overall health, hygiene habits, and even your diet. If you haven't already, subscribe to our channel now to receive more tips on effectively identifying and treating illnesses. And don't forget to share your thoughts in the comments. What strategies have you implemented to manage health concerns like cystitis? Share your experiences with us. Let's engage in a conversation. Now that you're familiar with recognizing recurrent cystitis, let's delve into its effective management. Treatment for recurrent cystitis is tailored to the severity of the infection and the frequency of episodes. Often, initial treatment involves antibiotics to eliminate the bacterial presence in the bladder. However, this may not always be sufficient, which is why physicians frequently recommend prophylactic low-dose antibiotics to mitigate recurrences. Besides medication, there are other measures you can take to ensure that cystitis doesn't resurface. Maintaining proper hydration is one of the most effective preventive strategies. Consuming ample amounts of water aids in flushing out bacteria from the urinary tract and preserving bladder health. Furthermore, urinating promptly after sexual intercourse, whenever feasible, is a crucial step in eliminating any bacteria that may have been transferred to the urethra during the act. Other strategies involve incorporating dietary supplements, such as cranberry, which aids in preventing bacterial adherence to the bladder wall. Probiotics may also prove beneficial in maintaining a balanced intestinal flora and mitigating the risk of urinary tract infections. As for diet, it should be well balanced, excluding foods that may irritate the bladder. such as spicy foods, caffeine, and alcohol. If you've tried various treatments and recurrent cystitis persists, it may be time to discuss alternative treatment options with your physician, such as hormone therapies or even immunotherapies. Every case is unique, and only a medical professional can provide tailored guidance for your specific circumstances. Preventing recurrent cystitis involves simple yet highly effective measures. In addition to maintaining hydration and adhering to a balanced diet, opting for cotton undergarments and avoiding products that may irritate the genital area, such as fragranced soaps, can significantly mitigate the risk. Intimate hygiene should also be practiced correctly, always cleansing from front to back to prevent the spread of bacteria from the anus to the urethra. Limiting the use of antibiotics and opting for natural remedies whenever possible can also help safeguard your intestinal flora and mitigate the development of bacterial resistance. And remember to maintain an active lifestyle, engaging in regular physical activity and managing stress, as these factors also exert a significant influence on the health of your immune system. These subtle lifestyle modifications can significantly decrease the risk of recurrent cystitis. Of course, it remains crucial to diligently monitor your health and seek medical attention when required. In conclusion, recurrent cystitis is a treatable condition, but it necessitates ongoing attention and care. The first step is always early diagnosis, followed by appropriate treatment. If you are experiencing this, know that you are not alone. With the right treatment and some adjustments to your daily habits, it is possible to control and even eliminate recurring urinary tract infections. Now that you know how to identify, treat, and prevent recurrent cystitis, we'd love to hear more about your experiences. How do you manage cystitis in your life? What strategies have proven effective for you? Share your insights in the comments below. And if you found this